Hey, good morning. It's Wednesday, July 20th. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Thanks for joining us on another Open Mics with Dr. Stites. We are on Facebook, YouTube, and Twitter. Coming up today, it's the ultimate try it before you buy it experience. High school students getting an up-close look at different careers in healthcare. Okay, we're going to talk about how I would have done that as a high school student because I would have flunked. For many, it's their first peek inside a hospital, from the morgue to the medical pavilion, and we'll talk with them to see what they've discovered so far. We'll also find out what our COVID numbers look like and see if the alarming trend is continuing. Hint, the numbers are still going up. Questions from our viewers are an important part of this program, and we want to hear from you. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You'll find those links right here on your screen. Before we get started, though, we're going to talk about the heat. A live look at downtown Kansas City, where the temperature today is expected to approach 100 degrees and then go over the century mark on Thursday, Friday, Saturday, and Sunday. Now, global warming, I think maybe it's real. And the weatherman tells us the heat index is going to be even higher. So what do these things do, especially with older adults? Joining us now is our expert on things related to geriatrics, and I'm going to be careful here how I say this because I have to probably classify myself in this group. Dr. Jessica Callender-Rich, a geriatrician here at the University of Kansas Health System. Thank you, ma'am, for joining us today. Now, just so you know, I've known Dr. Jessica Callender-Rich, that says a lot, for a very long time. So I'm going to be calling her Dr. JKR, or just JKR, because I've been doing that since she was a resident. We know that being hot for too long can be a problem. It can cause a number of illnesses. We call all that hyperthermia. Dr. JKR, if I may be so glib, Dr. JKR, talk to us a little bit about what some of those illnesses are, especially for the elderly.
I mean, as we think about hyperthermia, we start to get worried about sort of the three phases of hyperthermia. So things like heat rash, onto heat exhaustion and heat stroke, and different phases in between. And what's really important when we think about hyperthermia is we think about how it can really affect the body. And so we want to be sure that people are staying hydrated, staying in the shade, staying in a place that makes sense for it to be as cool as possible. And that, you know, although we lump all of these things under hyperthermia, what's really important is that we do everything that we can to prevent any of these signs of heat.
So thank you. So that's a big deal. But tell us, why are the elderly more at risk than, say, someone who's younger, like some of the guests we'll be talking to in just a moment?
Yeah, so as we get older, our bodies work harder and harder to keep themselves in this normal range. We call it homeostasis. And so when they're working harder to keep our bodies at a normal temperature, and by the way, generally speaking, just working harder to maintain the normal functions of the body, the heat makes that even more difficult because our bodies are working so much harder to maintain the body temperature that they don't have as much energy left over to maintain a lot of the other things that we need for our bodies to function.
All right, so let's just put it out there. As the oldest person back here in the studio today and kind of back here all together, you know, we have to, first of all, let's talk about what is older. Here's what I know of my days as an ICU physician. You know, as you get older, you don't respond as well. You don't sweat quite right. And you think about what are the ways our body gets rid of excess heat. So humans perspire. That's one way we do it. We can breathe faster because we can get hot air out through our lungs. And then we can try to move toward more cool conditions. So think about it. Each of those gets harder as you get older, right? First of all, you don't quite sweat as well. Second of all, you don't deliver as much blood to the surface of your skin and out to all your hands and your feet because you don't have the same level of heart output and you don't have the same ability to get blood flow distributed. And then we don't breathe as well, and sometimes our lung function is limited, which really can hurt that. And then the next thing is we don't move away from hot sources as well. So Jessica Callender-Rich, anything else you want to add?
I mean, all that together, and you add in the decreased thirst mechanism. So our mechanism that sort of triggers us to drink decreases as we age also, even for people that don't have any cognitive impairment. And so we have to remind ourselves to drink and drink early and drink often, even before we get thirsty. That's true for young people, but it's even more exceptionally true for older adults.
So you start seeing that heat wave coming this direction, really the time to hydrate is like right now, maybe it's yesterday or the day before you get started, because it really makes a difference.
It really makes a huge difference. We want to stay hydrated. And of course, we want to be sure that we're drinking a little more water when it's really hot outside, because even though we're sweating less with aging older adults, we are still sweating, of course, and still getting rid of that extra fluid, and we need it. I mean, there's always the risk of drinking a little bit too much for people that have certain health conditions. So we want to be really careful for people that have heart failure or kidney function issues or other conditions that may impair their ability to get rid of extra fluid. But most people will need to drink more when it's really hot.
How much is too much water?
Too much water is a whole lot. As long as your kidneys and heart are working relatively normally, you would have to drink a whole lot of water before it would be too much. And we often think about drinking at least at minimum, kind of the 8 ounces of water, 8 glasses of 8 ounces of water a day. You really want to drink at least probably 50% more of that, so at least 12 when it's this hot outside.
So that's a lot. And sometimes older folks, they don't want to have to get up and go to the bathroom as much, so they stop drinking. Very clever trick. If I don't drink a lot of water, I have to go to the bathroom. But then when you get hot, bad news.
It is bad news. And the other thing, the other little trick is the less water you drink as an older adult, actually it irritates the bladder and you have to get up more. So that little trick doesn't work as well as we think.
All right. So by the way, what's an older adult?
So an older adult, I know I come and I talk about older adults, and it's really about a combination of age, other medical conditions, and function. So if you are very young but have a lot of medical conditions and maybe still struggle to get up and move around, that still makes your body function as an older adult. But the same is true for somebody who is in their 80s or even 90s that walks 3 miles a day. Those people still fall into that category because they still have that age piece of it.
Well, I think what's also important to say to our audience is there's not a light switch. You don't turn old over a day. All this is a transition over time. So how you'd handle things when you're 17 and 18 is a lot different than when you're 35 or 40, which is different than 50. And oh my God, it's definitely different than when you're 60 or 70 or 80. So things change over time, right? So Harvard study tells us when the temperature goes above 96 degrees, our minds don't perform as well. My wife kind of wonders about that. I think she would probably claim that happens to me all the time. All right, that includes problems remembering, learning, and concentrating. Talk to us about why that is.
There are a lot of theories floating around. We actually do think that your body uses a lot of glucose, like I mentioned earlier, to maintain your temperature. But your brain is also using glucose to function. And so there's competition there. And so we really do believe that as there is less sugar available for your body to use, not that I'm saying we should all go have a bunch of sugar for breakfast.
Let's not say that.
Right? But your body needs that glucose to function in both realms, and there's less of it going around. And so it really impacts the way that our body uses and metabolizes the available nutrients that it has.
So we have to drink a lot of water, but are other things also suitable liquids, say a beer? It gets hot, cold, crisp beer, that's all good.
I mean, a beer sounds great, but I would more consider things like sports drinks, maybe even a little Pedialyte if you're feeling really dehydrated. Certainly having a well-balanced diet, lots of fruits that have a lot of water in them and veggies. Those things are going to be really helpful to maintain that water within your system.
I think it's actually important to say to our audience that you want to avoid those things that are going to make you go to the restroom more, like a lot of caffeinated beverages and yes, alcohol, because those both stimulate your need to urinate. And that's not what you want to do when you're trying to hydrate. Urinate, hydrate. There's a little bit of a contradiction there. All right, scientists in the UK found that heat can trigger fear, depression, anger. Based on what's going on in the UK right now with their heat, I bet they have a lot of fear, depression, and anger. Why are we in an emotional roller coaster with heat?
I mean, some of it is just that our mood changes when it's hot, but a lot of it, especially for older adults, is that they don't go out as much. And we know that social isolation can be really critical for people maintaining their mental health, right? And so this thing that keeps us inside and keeps us in the air conditioning also isolates us away from the people that make our lives feel meaningful sometimes. And so that can really affect our mental health and cause an emotional roller coaster.
Yeah, and I think I just get grumpy when it gets too hot outside. All right, so we have to go check on elderly relatives, neighbors, etc. Can we do that on the phone? Do we have to go eyeball them? What's your preference?
I mean, I think it depends on the person. If you're talking about somebody who really is going to tell you how they're feeling over the phone and who is also capable of getting to the faucet to get water pretty easily and that you believe really will remember to drink, I think over the phone is okay. But in a lot of ways, it's still good to check on those folks at least every couple days. And certainly if it's someone who has a history of getting dehydrated or having any sort of recurrent illnesses or hospitalizations, those people probably need eyes laid on them.
And Dr. Jessica Calderon-Rich, so many words right there. Dr. JKR, we were messing around about this before this program started. So as I think about it, the person who feels like they're the most at risk to me is the person who's not mobile, because they may have a hard time getting to liquid, they may have a hard time getting to the bathroom, they may have a hard time getting away from the heat. So I think that lack of mobility puts people at a higher risk.
It puts people at a much higher risk. Even in normal situations, we see folks that come into the hospital who have had trouble with access to water just because they can't get to the sink across the house or across the room or don't remember to do so. And that's especially more important in all of the heat. And it's really critical that we check on those folks and make sure that they have simple things like a pitcher of water next to wherever they normally sit, a secondary pitcher of ice water that's there waiting when that one's gone, and that we're coming by and checking that that water is actually going down.
And just to say, many folks who don't have air conditioning are going to be an extremely high risk. So having a fan placed or trying to get somebody maybe to come over for a few days where they can be in a little more of an air conditioned environment. Okay, Dr. Calderon-Rich, before you leave, I know we have to go to questions. I know Jess has one, and I know you have to head out, but nursing homes and COVID, how are we doing right now?
I wish I could tell you that nursing homes and COVID were doing as well as they were several months ago, but we are starting to see the impact of rising rates within the community. And we know that as rates rise within the community, they also start to sprinkle their way into nursing homes. And there have been several outbreaks that have been pretty big actually in our community, and many that are much smaller. And this is despite increased testing, increased availability of PPE, and really a lot more knowledge. And so we've seen a lot of COVID units sprinkling up. I would say that if your loved one is in a nursing home or is considering going there, whether it's for skilled nursing care or for to live there, just know that the facility is doing the best that it can, but that it can only do as well as we're all doing in the community.
Yeah, I think that's a great point. You can only do as well as you're doing in the community. Jess, I understand that we may have a question, so I'm going to pitch to you.
Okay, so Dr. Calderon-Rich, you may have already gone over this, but go over it again, if you would, please, for Yen Ling. It is reported that people should adjust their water intake according to the temperature. She wants to know, would 10 cups a day be enough for the temperatures we're seeing out there right now?
I think it all depends on what you're doing. If you're staying inside, in the air conditioning, 10 cups a day seems like a really reasonable amount. If a person is spending a lot of time outside or doesn't have air conditioning or access to other ways that they can be cooled down, that's when we really have to start thinking about more. That said, there are many other ways to cool oneself. So things like wet towels put on their necks or on their feet or on foreheads. Cool towels in front of fans can help blow cool air at somebody. There are just other things that we can do because we want to be sure that we're balancing the hydration within the body to help cool them down with any other sort of medical conditions that may exist.
Yeah, and fans help cool you down, not just because maybe they're blowing colder air, but it's the reality, it's the air movement to try and take perspiration off of you to help dissipate heat. And so fans work for a lot of different reasons, and they can become really important. Well, Dr. Calderon-Rich, I know you have to go. I want to say thanks to being on the program today. Really appreciate your input, and you are always welcome down here. So thank you so much.
Thanks.
Hey, when you were in high school, did you know what you wanted to be when you grew up? Maybe some of us knew early on. I didn't. I thought I was going to be an environmental defense lawyer. But knew early on, when we are in Star Trek and have joined Starfleet, we wanted a career in the medical field. But how do you really know until you get a chance to see different careers firsthand? Our health system realized there's a need to give high school students an up-close look at different jobs in healthcare, so we did something about it. Joining me in the studio is Vanessa Goldsberry, Director of Volunteer and Guest Services at the health system, and Kayla Koenig. Did I say it right?
Yes.
All right, I nailed it today. That's one. volunteer coordinator, to talk about this first of its kind program. And joining us live from our core lab is Alexis Del Cid with several of our volunteer students. We're going to find out what they've been up to this summer. Vanessa, why are we doing this? What's the goal of the program? Talk to us about how unique it is.
Well, we think it is the only program of its kind here in the Metro. And really the idea, as you mentioned a moment ago, Dr. Stites, is we really want to give this next generation an opportunity to really see what it's like to work in a hospital, work in a health system. And so the goal of the program is to kind of start planting those seeds right now, give them those experiences and see what it's really like behind the scenes. And outside of also the medical, it's clinical and non-clinical. So that's the goal.
That's pretty cool. Now, how many students do we have? Where are they from?
We have 51 students.
How many? 51?
51.
That's
51.
a lot. That's great.
And they come from all corners of the Metro, north, south, east, west, Missouri, Kansas. So we have some as far north as Smithville and one as far west as Lawrence.
Oh, that is great. So, Kayla, they're not just standing around and watching. So tell us a little bit about what's a typical day look like.
Yeah, so they get here about 8:30 in the morning, and for the first 3-ish hours of their morning, they are in our clinics volunteering. So we've got some over in our medical pavilion, we've got some over in Cambridge, we've got some over in Bell. And then they go to lunch, and then in the afternoons we have what we are calling our afternoon experiences, our learning experiences, where we have departments from all over the health system that are teaching these students about what they do in their departments, both like what Vanessa said, clinical and non-clinical. So we're giving these students a really good look at what it's like to work in a health system if they want to go into the clinical setting, but also if they want to go in non-clinical. So it's a very good learning experience.
No, I think it's really important. Just to put a little information out there too. You know, one of the challenges we have in the pandemic world is that applications to nursing schools are down, and some of the other health professions are down. And we're a little nervous about what that means for our supply. And I think we thought, hey, this experience in healthcare could maybe encourage more people to go into this area.
Absolutely, and that is exactly why we started this program, because we really wanted to give these kids an opportunity to see what it really takes to run a health system of this size and scope and all of the different careers and different opportunities that we have here. So whether they want to go into medical school or if they really just don't even know what they want to do, we have a place for them.
Yeah,
so,
I think that's great. I mean, especially I know our School of Nursing numbers were way down this year, and nurses are the backbone of healthcare, especially around this inpatient unit, and I can't imagine how a hospital could take care of patients without our outstanding nursing team, and so that's a really critical program. Vanessa, what makes this summer different from other summers?
Well, as Kayla was sharing, we have afternoon experiences for them that has never been done before. So they have the opportunity to work with the patients, work with our staff, be supportive, and then in the afternoons really get immersed in a certain area of our health system and learn about it. And we really are just hoping that something will spark in them and they will get excited about healthcare and decide to be a part of us. So
that's pretty cool. What's the favorite area so far?
Oh gosh!
Don't tell me the operating room, because I'm a medical guy. Don't give me that horror stuff.
We've had some really great feedback on multiple areas, but I have to say,
okay,
well, we haven't been in the OR yet. I think that would be top if we were.
Oh man, I'm going to go after some more searches about this. All right, so we made some changes this summer, you said, and so that's a pretty big deal. Anything else you guys want to tell us right now about our students? And
they are having a great time. This is also the largest our program has ever been. So I think the last time this program was up and running was summer of 2019, and we had about 20 students.
I was going to say, let's be honest, we closed this program because of COVID, and now we've opened it to go from 20 to 51, and I think we know how to do it safely. We know how to do PPE, and we know we can keep people safe, so it feels a lot better.
Yes, it does.
That's awesome. All right, let's hear from some of our volunteer students themselves. Alexis Del Cid is in the hospital's core lab with 4 of them. Alexis.
I'm here with 2 of those students, Dr. Stites, and they are having the best time this summer. I'm here with Molly and Isaac. First, what high school do you go to, Isaac?
I go to Blue Valley Southwest.
I go to St. James Academy.
So, rumor has it, one of you got to touch a brain, which must have been amazing. Which one of you got to touch the brain?
I did.
Okay, what was it like to touch the brain, and tell me the circumstances?
It was so weird. It was like a squishy, like rubbery feeling. So like they were giving tours of like the morgue, and so we all got to go down there and see like dead bodies that were like in bags, and it was really cool.
And that's such an emotional experience too, to be able to be hands-on in something like that. And Isaac, you were telling me you've spent some time in orthopedics, and one of the first things you saw was the removal of a cast. Was it what you expected it to look like underneath?
Actually, I've broken my arm and had casts taken off before, so it was more or less what I had already experienced myself. But I've seen some like casts taken off feet before and of hands, and I've seen casts and splints put on and staples and such removed. A lot of experiences in the orthopedics department, definitely.
Would you say orthopedics is what you're interested in most after high school? How has this experience shaped you?
It was definitely what I was interested in before coming to this program, and I think I definitely still have a heavy interest in it. It's just I'm figuring out kind of what else I could look for after the, like if I were to go into medicine. So it did give me that experience, which I'm thankful for.
And Molly, I want to ask you, did you always want to go into medicine? Was this something that you had your eye on as a possibility to be part of this volunteer program?
Yeah, definitely. Before coming into this program, I knew I wanted to be in the medical field, like a nurse or something like that. And I think it like has furthered my interest in wanting to come into this experience.
One of the things that Dr. Stites and Vanessa have been talking about is there's a big waiting list to get into this volunteer program. Isaac, how were you able to wrangle a spot as one of the inaugural students?
Well, the process that we did to get into this was writing a relatively short essay, and then we actually came in for an interview after that. And I was not aware that there was a waiting list, but I heard that it's actually got pretty long. I think Ms. Koenig said there was at one point like 60 students on it. And so I think that just having that essay and interview out there is what got me the spot on here.
And Molly, what about you? You're nodding your head as Isaac was answering.
Yeah, I had the same experience. So it was the short essay, and then we came in for the interview, and we basically just talked about like why we wanted to come in here and what our interests were with the hospital.
So as far as other summer experiences that you've had throughout your childhood and teenage years, how does this one stack up?
It's definitely like one of my favorite experiences by far. Like I've got to learn and see so much that goes on in the hospital setting. It's made me even more interested to become like a nurse.
That's what we love to hear. Isaac, what about you?
Oh yeah, I would definitely agree. It's been a really cool experience, and I've definitely seen and like gotten to experience so many things that people at my age aren't experiencing otherwise.
And I don't know, you can probably tell, I know we're all wearing masks, but there are some big smiles underneath these masks because they're so happy. What a cool experience. And speaking of cool and interesting, we're here in the core lab. This is really the heartbeat of the hospital. I was talking to the people who work here. This is where all the blood and the specimens and everything for the entire health system is processed. It all comes through here. And some of the students have even gotten to see, Isaac, I know you said that, gotten to see when specimens were brought down here. And we have these big tubes behind me that we're going to show you where they take the specimens to the rest of the hospital. It reminds me of when you're at the bank and you send your check through the teller system and it shoots up through the tube, except this is far more important than that, I assure you. This is truly the nerve system, the nerve center of the entire health system. What a cool place to be. And Cliff is doing a great job navigating around all this very important stuff with all his gear. Hats off to Cliff, our photog this morning. We have 2 more students we're going to bring you in just a little bit. Each student has a very interesting story of what they've seen and what's been their favorite part. Truly is a joy, though, to meet these young minds and hear about what they've loved and how this is shaping their future. Back to you guys.
Yeah, that's pretty cool. So, you know, here's a story. When I was in high school, I couldn't have thought about I was going to go into medicine because if I watched a medical show, which back then were like Marcus Welby, MD, or Dr. Kilgore, or whatever his name was, I would have nightmares that evening about, you know, broken ankles or because they didn't even do anything big in those shows, right? Broken ankles or appendix coming out, or, you know, I got a fever, and pretty soon the whole world had broken legs, and there's no way I was going to go into medicine back then. Fortunately, something changed, and it all changed. But man, this was not available back in the dark ages like that. Okay, so we know many of you have questions. Let's head to Studio B and Jessica Lovell. I actually said your last name right. I'm on a roll today. Watch out.
Well, I know. And after knowing each other for 3 years, I mean, I think that is a big deal. Thank you.
Yeah. Well, I'm a slow learner. As
I
evidenced.
wouldn't know. I don't know if I would know to answer to you without you saying it wrong.
Yeah.
Only you can, but only you can do that. So
Okay.
anyway. Okay, so Isaac, the student that Alexis was talking to, I think mentioned this, but Andrew says, I have a daughter who would be interested in this type of program next summer. Is there a minimum age? And what does she need to do, maybe to start planning now? What does she need to do to qualify or sign up? What's the process?
All right, team. What do you think? What's the answer?
So the minimum age is 14. So as long as the student is 14 by the time the program starts, they are absolutely the right age to participate. And as for signing up, our summer signups for next year haven't started yet, but the process will be very similar to what we did this year. We'll be accepting applications. There's an interview process, a short essay, and then we will start that process and notify the student if they've been accepted into the program. So we'll be looking at doing that sometime early January, March through March.
How do we make sure that all the schools throughout the area know about this program?
So that's a great question. We start with our partner schools and we make sure that they have the information, and then we really rely a lot on word of mouth from
What's
our
a partner
volunteers.
school? How do you get to be a partner
So
school?
our partner schools are those who have agreements with us to bring their students here for their health sciences classes where they can come and be up in the units. So we have 4 partner school districts right now in the area, so we start with them, and then we really are hoping that the word is going to spread. So,
All right, cool beans.
Yeah.
All right, Jess, any other questions right now?
Yeah, one quick question for Vanessa. You had mentioned, Vanessa, how the students aren't going into the OR just yet. Are there any other areas, or what areas are off limits right now to students, and maybe why?
Well, some of it really just depends on if we have any volunteer opportunities for them. This year being the first year that we've had this structure, we were creating those experiences based on, really the interest of the department, and if they had the ability to host us on a certain afternoon. So I would say that at this point next year, it could be a very, very good possibility to have something like that. So really, it's really more just about having the conversation and getting that department excited about hosting the students.
All right, good stuff. Thanks, Jess. We'll check back with you in a little bit more for community questions. Let's check now on today's COVID count. Here's the numbers, guys. Pop it up on our screen. So we have 34 active patients. That's staying fairly stable, but 8 are now in the ICU. That's a little higher. We were at 2 or 4, 8 up there. You don't like that number. 3 are on ventilators, 14 are recovering. It gives us a total of 48 patients in the hospital. Remember, we don't do testing on every admission now. If we were doing that, we'd probably be more in that 60 to 70 range. So I don't like the numbers in the ICU. That bugged me a little bit, and something we'll really have to keep an eye on. And we're seeing this kind of thing pop up a little bit around the country. I think we have some New York Times graphs we're going to take a look at for just a minute. You guys know I like to talk about this a lot, but I think there's so much information in these graphs. First of all, remember we talked to Jessica Calendar-Rich a little bit ago about what's going on in nursing homes? This is a graph by age, and as you can see, the older you are, the curve's going back up again. And if you compare where we are now with the BA.5 variant, we're getting back to where we were with the Delta variant. I don't like that wave, and the numbers are going up. And you can see the big hump that's right before where we are today was the Omicron variant, and right before that was the Delta variant. Okay, next. And this is over time, and it's talking about the percent positivity of tests. Now remember, unfortunately, we don't do a lot of community testing anymore. And so I'm not even sure that the numbers are truly comparable, but any way you look at it, the percent positivity is now the 3rd highest it's been throughout the entire pandemic and is continuing to rise. So again, there is a lot of BA.5 out there. Most experts would say to us that the BA.5 variant is probably now the highest, probably got the most number of patients infected at any one time, maybe more than Omicron, but certainly as high as the original Omicron we saw last January. This looks at hospitalizations and ICUs. You can see those numbers going up. Sorry, guys, I got behind you a little bit. And you can see the hospitalization. Then the ICU numbers have been flat, but we're seeing our ICU numbers start to rise again, a trend we'll have to watch for. The overall numbers are much higher thus far than hospitalizations. I think that's good news. I think what it tells us is that it's not that this is less severe, because we see in countries where the BA.5 is being exposed to populations who haven't had COVID and aren't vaccinated, that they're getting just as sick as they would have if they'd gotten Omicron, Delta, or the original strain. Rather, what it's saying to us, I think, is there's a lot of host immunity, either from vaccination, 67% of Americans have had at least one vaccine, and B, it's showing us that a lot of people have had COVID. So they may not get as sick yet. And I say yet because we're still on the rise. We'll have to see where that takes us. It may just be a little bit more of a slow rise. Deaths by day staying relatively flat, but beginning to show a trend. And again, it takes a while for the deaths to catch up to what the peak is. We're a deaths like 2 to 6 weeks behind that. And if you just look at the new reported cases over the last 90 days, you can see this kind of slow rise up. You see, what are those gaps in between the peaks? Those are actually weekends. And so then you see 5 days in a weekend. 5 days. So if you look at that over time, you can see the slow increased rise. And remember, a lot of cases are not being talked to us about because they're being tested at home. And there's the new reported cases for all time. Okay. Heat map. Man, it's looking a lot more orange out there. Things are getting worse, and we're living in 3 red counties. The core 4 is now all red on the CDC risk index. So that kind of matches up with this heat map. And if you look at the next one, I think there's a map, maybe not, about hospitalizations. So there you go. So the hospitalizations, we showed this a couple of days ago, but look at in Florida, look at over New Mexico, Arizona, look at some parts of Oregon, Northern California, starting to see some things pop up, a lot of little hot spots popping up there. So what does that tell us? It tells us that this BA.5 strain is not to be trifled with. It says to us that if you're at high risk, you need to start thinking about taking those preventive measures we know work. What are they? Well, remember what we've always said. The rules of infection prevention and control travel with you. They go wherever you go, and they can keep you safe. And what are those? Keep your distance. Stay outside. If you're sick, don't go around others. And I hate to say this, but wear a mask, especially if you're at high risk. If you're going to go into big crowds, there's a lot of BA.5 out there. You have to ask the question, is it okay for me to be at risk and then not wear a mask? I know I'm wearing a mask again in the grocery store and when I go into crowded indoor settings. Not all the time. I don't think it's back to those levels because we're not seeing the same rate of hospitalizations, and that's what will really push us. But let's stay tuned because I think we have to watch and see where we go on these trends. All right, back to our discussion now. Joining us in the studio are Vanessa Goldsberry, the Director of Volunteer and Guest Services at the Health System, and Kayla Koenig, Volunteer Coordinator. I said it right a second time, didn't I? Yes! All right, we're talking about a brand new program designed to give high school students an up-close and personal look at different careers in the medical field. We'll also return with Alexis Del Cid in our core lab with several of these students. Alexis, I get to ask somebody a question, I hope. All right, Kayla, we understand their first week here. All the students got some special training. Is it true they all got to hold the human brain in their hands, or was that just kind of a individual person experience?
Yeah, so their first week here, they were all AED and CPR certified by our Magnet team. They went in and they spent the afternoons getting CPR and AED certified, so all of them hold that certification now, which is wonderful.
That's a big deal.
I even did it myself.
Save a life. I like it.
And then, yes, so our anatomic pathology is one of the afternoon opportunities that these students are getting to do. Not all of them have done it yet. I think tomorrow is our last afternoon opportunity for that. So almost all of the students have gotten to hold the brain if they've been here on that day and everything. So yes, getting to hold the brain has been, when they come back in, I'm like, how was your day? Well, we got to hold a brain. So it has been that's been a fun one for them so far.
Yeah, it's a pretty big deal.
It is.
And brains are fascinating. It looks like this kind of very funny bowl of brains, if you know what they are. So, all right, Vanessa, what do you see? What do you see the future of the program looking like?
I fully anticipate this high school program next summer we could easily double in size. It all depends, really. I think if we have enough places to assign them in the clinics and in our departments. But I think the interest and the response that we've had this year has been so positive. It's been so exciting. This has really been a special group for us because it took 2 years to get them here. The plans for this actually started in February of 2020, and of course that we all know what happened after that. So this has been a really special group. So I think next year, I think we could double it if we have
more
things
capacity,
for
more
them
ideas.
to do.
I
Yes.
see you looking at me like you got to help me get more people in the program. So,
That's right.
All right. So that's a big deal. Now, the next turn of phrase here is that summer is winding down. I don't want to disappoint our students and make them think that summer is winding down, but I guess it is July the 20th. Man, I would say summer's still going full bore, but I guess it is kind of get out there. Can high school students continue volunteering during the regular school year?
Currently, the high school program that we have in the summer is what is available. If high school students are 18 and over, they would be considered part of the adult program. So any program for 14 to 17-year-olds, currently this is our summer program. We are looking to expand that to potentially have some things for them, but they'll just need to be on the lookout for next summer.
All right. Let's go back to the hospital's core lab. That's where Alexis Delcid has been hanging out with 4 of our volunteer students.
Dr. Stites, I'm here with 2 more of them. I have Keely and Arush. Talk about high flyers. These are kids that have already had extensive experience during this volunteer program. Keely, what school do you go to?
St. Teresa's Academy.
And Arush?
I go to Blue Valley High School. I'm going to be a senior next year.
You have had some pretty cool experiences here, Arush. Tell me where you've enjoyed volunteering the most and the kinds of things that you've done.
So I've been in the orthopedic section the most, and we've done a lot of different things, more like hands-on stuff and like hands-off stuff. I think the coolest things I did was like helping put a cast on like legs and stuff, and also seeing like stitches and pins being removed from like arms, and that was really cool to me because I didn't know like how long they were. So I started taking it out. I was like, whoa, that's kind of crazy. Yeah, I didn't expect that, but yeah, those are the coolest things I've done so far.
Before this, you knew you wanted to be an orthopedic surgeon.
Yeah, I was pretty sure about that.
So this solidified.
Yeah, so I kind of just came here to like make sure like I got an understanding of like the medical field and see if this is something I really want to do, and I've really enjoyed it so far. So I think orthopedic surgery is definitely something that's going to be in my future. So yeah.
Now to Keely, who's our St. Teresa's student and a volunteer. Keely, you already work in the medical field. You're 17. What do you do?
So I'm a certified nurse assistant. So basically it's those people who help out and do most of the patient care and help with nurses. Unfortunately, I don't work in a hospital or anything like that, but I've been trying to get a job recently. But it's definitely been an amazing experience working in a hospital and seeing what different things are here.
I got to ask you, as a 17-year-old, when I was 17, I could barely make it to class on time in the morning. Barely. How are you able to be a certified nursing assistant and go to high school?
So I did have to skip a few periods at the end of my classes to be able to get certified. But it's really just about focus and determination. And if you put your mind to anything, basically you can get anything done. And really believing in myself to get that done. And it's also, I don't know what I want to do in my future, so I don't know if it's going to be medical or anything like that. So having that curiosity to kind of experiment with what I want to do and look around definitely helps me move.
And what are some of the things that you have experienced here at the University of Kansas Health System volunteering that might have helped guide you or shed some light on some questions that you had?
So I'm working in interventional radiology, and so it's a lot of patient care and helping patients get to their room, cleaning up the beds when people are done with it. But it's really influenced me to help see what the difference of a hospital versus other places are like, and see the difference of those two things.
It is so interesting and unique and fun to be able to talk to these bright students and kind of pick their brains, pardon the expression, and really learn what makes them tick. And it's so nice to know that there are young people like this coming up in the world, that we have them here among us, and it's kind of shaping their dreams, because these are going to be the people who are going to be caring for us when we need help eventually. And gosh, maybe in a few years from now, at the rate they're going. Back to you.
Well, thanks, Alexis. Hey, just as a thought, by the way, we have to think about these kids and how old they are, but also that there's a little preponderance towards the orthopedic surgery field. I'm going to talk to these kids a little bit about that. We'll have a conversation later. All right. Jess, are there any reporter questions today or community questions?
Yeah, so we do have a few COVID questions I wanted to ask you about. Mike wants to know, with ICU admissions increasing for the first time in many weeks, can we get some general demographics of who is experiencing the most severe illness?
Yeah, you bet. It's kind of what we heard from Dr. Jessica Calendar-Rich earlier today. The older you are, the more at risk you are. We also know that if you're fully vaccinated and boosted, your chances of landing in the ICU are a lot lower. So if you really want to land in the ICU, don't get vaccinated, don't get boosted, then you're much more likely to be there. And I think the other point, again, those over 75, those over 65, 70, are going to be most at risk for needing to be in the ICU, or if you have really significant underlying disease, chemotherapy for advanced cancer, organ transplant with rejection, things of that nature.
Okay, another question. What do the doctors, that would be you, think about a study the NIH website had from the European Med Agency? Not sure if you've seen that, but you might know about this. It stated that frequent booster shots could adversely affect the immune response. What's with that?
Well, Hawkeye's probably better equipped. He'll be back next week. I know we talked about that last week. You know, there's some thought that that could be true, they could deprogram it, but there's not a lot of evidence for that because thus far at least, people who are getting boosters are not getting sicker in other regards, which means that if you really had a decreasing your immune response, what would happen? You'd see the rise of other diseases. We're not really doing that right now. And I think what we're seeing instead, because of the narrow nature of the booster shots, really, they're very targeted at just the spike protein and some very specific regions of the spike protein. Don't know if that's going to really be a concern with booster shots. We also have to determine what frequency is. And then you also have to think about what are the risks of getting sick from the booster versus what's the risk of getting sick from COVID-19. I think the evidence thus far overwhelmingly suggests that COVID-19 is the biggest risk.
Vanessa, Bridget says this is just a wonderful program and has a question, and maybe it's a suggestion as this program continues to develop, but she's asking, can students repeat the program if they're accepted, or is it just a one-time experience? Could they do it 1 year and then maybe come back and go through some different areas the following year?
That's a really great question. And to answer the first part of the question, absolutely. We would love to welcome any student who's participated with us to come back next year. And I love the suggestion of maybe trying some different areas if they have been with us before. So remember, this is a brand new structure. So we are open to lots of ideas.
Yeah, it's going to be a little hard, though, if you got a long waiting list of people who have never been in the program, and then you have somebody who's a repeat. How would you think that would go?
Well, it really depends on if they, the timing of their application and, having those conversations
do we still have
at
a
that
waiting
time.
list next year? Do we get 100 students in, so then there's no waiting list? Yeah.
Well, if we can grow the program, we absolutely would love to have all of them.
All right. Jess?
Dr. Hawkinson, just give some advice on this.
Dr. Hawkinson, hello, wait a minute. Oh, yes, you called me the wrong name. Okay,
Sarah,
Jessica
you did it on
Lovell.
purpose.
All right, Lovell, what are you doing?
Okay, you deserve that after all this time.
Yeah, probably
okay,
so.
Dr. Stites.
Live long and prosper.
Yeah, right. Okay, give some advice on this, and I wish Dr. Calendar-Rich was here because this is kind of more for her, but I think you've got this one. If you've had COVID, if you've been COVID positive and feel better after 5 days, should you go to visit an elderly relative in a retirement home, even though you will be wearing a mask? So even mask, but 5 days out. What are your thoughts?
No. Here's the thing. Can you do it after 5 days with a mask on? Technically, maybe. I don't know what the nursing home rules of that, but should you? No. You may still be shedding virus after 5 days, especially the older you are, you may shed a little longer. So I think that you're better off waiting 10 days to see an elderly relative who may be especially at risk in a nursing home. I would give that person maximum grace against COVID.
Just last question, and I'm combining it because we're getting a couple of masking questions, but have the docs seen any studies done on the how efficient masking is with the Omicron variant? And early on, there was discussions that masking helped prevent the person wearing it from spreading it, and now it's the person now the focus is on the mask as the wearer protection. So why is the message changing?
Let's
kind of
go
help
back.
them with that one.
Let's go back. You bet. So really, the emphasis is still on wearing a mask to help spread the disease to others. But we also know, even with the BA.5 variant, that simple masking, cloth masking is a little weak, but then a simple surgical mask, or you can double layer, you get the right kind of cloth mask, is better than no mask. It does clearly reduce your incidence of disease, even with Omicron. And then the more sophisticated ones, like a KN95 or even an N95, will really reduce it. So depending on the fit, depending on how you wear it, depending on whether or not the mask is wet or how long you've been wearing. Is it a new mask? Is it a mask you've been trying to wear for a week? So all those things take into effect. But the reality is that, yes, masking does a better job of preventing you giving the disease to someone else, which is really important because BA.5 can be asymptomatic, especially if you're fully vaccinated, or it can do some reduction of how likely you are to get the disease. Is it as effective as an N95 mask or a KN95 mask will really reduce the chances of you getting the disease. So you got to think about what the level of protection is you're going to wear. All right. Let's go back to our guests now. Let's get some final thoughts from today. This has been a great program. I want to start with Vanessa. Final thoughts.
Well, we have just been thrilled at the response from our students and from our participating, supporting departments that we had, because we really could not have had such a successful summer without the support of our colleagues here in the health system. So we have so much appreciation for them, and as I mentioned, this has been just really such a special group for us, and we're just very excited about just the response. And I think we achieved our goal, which was for them to be engaged and have fun and to learn. So I would say that we will walk away from this summer with a success.
Yeah, I think you've got a great success. Yeah. Final thoughts, Kate.
I would echo what Vanessa said. We are just thrilled with this summer. I think when we sat down to start planning this summer, in our minds we were thinking, okay, 20 was previous. We had 20 students with us previously. Let's see if we can get 30. And when we hit over 30, we started looking through and figuring out what are the different places that we can put these students in our hospital, and it just exploded. So I'm incredibly impressed with the group of students that we have this summer. Even more impressed with our staff. Our staff has been so on board and just welcoming of these students. And I am so excited to see what this next year is going to bring when our applications open in January of 23, and to see what summer of next year brings us.
Yeah, that's a really big deal. And this is a great program. You think about those young folks holding a brain in their hand and thinking what's happening in their brain at that very moment, and the amount of stimulation it has. Here's the rest of my story. I told you before, I used to have nightmares about medicine, and I did, and healthcare in general. Man, if I watched one of those medical shows, I was out to lunch the next day. My first experience in medicine was as a lung collapse in a hospital. My second experience in medicine was as a son. My mom had a terminal lung cancer, and so she was in the hospital about 6 weeks before she passed away. My third experience was as a mailroom delivery boy and copy center guy at the old Independence Regional Hospital, which prior was Independence Sanitarium Hospital, which happened to be where I was born. I guess that actually was my very first experience. Then as a medical student, then as a resident. Things grow, and it's interesting the course you follow. But the most important thing to do is to remember that healthcare is a passion. And it's a passion because it's one of the greatest places in the world, because you get to know and understand science, you get to fall in love with helping people, and you get to do something for all of humanity. I just think it's the greatest career ever. And so all those students, nursing, medical school, respiratory therapy, social work, dietary, whatever it may be, physical therapy, what a great career. What a great place to be. So if you can't join Starfleet, think about a career in healthcare. All right, thanks for being with us today. Don't forget, you can catch our programs anytime by logging on to Facebook, YouTube, and Twitter. Jess, what's coming up?
Okay, you all are going to love this guy. We look back at the story of a very well-known area business owner who quit smoking after 45 years. He kicked the habit cold turkey, and it was not easy. That's in our special encore episode of the Morning Medical Update. We'll see you back here live Friday at 8. Make it a great day. The rate of autism has steadily grown over the last 20 years. It now affects 1 in 44 children. I'm Jessica Lovell. Coming up Friday on the Morning Medical Update. new research, and the program that's helping train those with autism for their future. See you at 8 on these social media channels.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.